Hello, my name is Dr. Malik Haruna King, and today we will be looking at some of the common causes of infertility and difficulty in some ladies having babies. Number one, there might be problem with eggs production. You see, ladies produce eggs, and this is called ovulation, and it usually happens every month at about the 14th day after the commencement of menstruation, and it is tightly regulated by special hormones and body chemicals. Now, when these eggs are produced and released, they join with the sperm cells from the male to form babies. Now, some ladies menstruate without actually producing eggs, and if you don't produce eggs, it's possible to get pregnant. Others produce eggs but have problem releasing it, and these eggs have to be released to meet with the sperm cell to form babies. Hormonal problems can actually affect eggs production and release, and fortunately there are tests to show if a lady is actually ovulating or not, and there are also drugs to help assist ovulation. Number two, they may have damaged or blocked tubes. If the eggs are produced, they are released and they pass through a very tiny tube called the fallopian tubes to get to the womb. Now, if one or both tubes are damaged or blocked, the chances of the sperm cells reaching the eggs and going through the tiny tubes to the womb to form babies are slim or not even possible. Some ladies are born with abnormal or blocked tubes. Also, there are infections that can block the tubes, like gonorrhea, genital infections, sexually transmitted diseases, infections after abortions, and other conditions like ectopic pregnancy, where there's pregnancy happening in the tubes itself. This could damage the tubes. There are some surgeries that can mistakenly block the tubes. When the wound is healing, it sort of adheres with the tubes and either blocks it or damages it. Now, there are ways to check if a lady's tubes are actually blocked, and there are also some delicate, expensive microsurgeries that can be done to repair damaged tubes. Finally, there is in vitro fertilization, IVF, which is actually a very good solution to blocked tubes. There might be problems with the womb. Now, the womb is where the baby forms, so it must be conducive and accommodating for a successful and healthy pregnancy. Several things can go wrong here. Some ladies are born with abnormal or malformed wombs and cervix. Other ladies can develop complications from abortions, especially D and C, forming all manner of bizarre complications, like the walls of the womb can get glued or gummed together, thereby occupying the space where the baby could have developed and grown. Also, some ladies who don't have babies early enough in their life might develop fibroids and other growths. You know, the womb hates being empty for long, so if you don't put babies there, it will try to fill it up with fibroids, and these fibroids and polyps could make pregnancy difficult and cause repeated miscarriages. Number four, the problem might be from the male. For every case of infertility, on the average, about 40% of the time the problem is from the male, and also 40% of the time it is from the female. There are several possible problems that could come with the sperm cells. There might be failure to produce sperm cells, problem with transporting the sperm cells. The sperm cells might be weak, there might be few, and all these reduce the possibility of pregnancy. The man might have damaged testes from diseases like mumps or gonorrhea. Also, excessive cigarette smoking could be the cause. Number five, the problem might be unknown. 20% of the time, nobody is sure what the problem actually is. Sometimes a lady might still be under the effect of previous contraceptive use, maybe an injection or an implant or pill she had. Also, breastfeeding can cause temporary delay in having babies sometimes. Now, did you learn anything new today? Don't forget to hit the like button and stay subscribed to keep getting educating videos like this. Stay healthy, stay happy now and always.